From the inferior view, in addition to the bones, we also see several bone markings that are important for us later. First, most anteriorly, the bone markings that you're going to see, these kind of look like little sharp processes that stick out. These are the pterygoid processes. They actually are subnamed, which is not on your lab list, as the lateral and medial pterygoid plates. And these are important muscle attachment sites for muscles of mastication, the ones that help you to chew, move your jaw up and down. As we work our way posteriorly, you can see on the occipital bone several features that are important. These little smooth areas are called the occipital condyles. A condyle is always going to be a rounded surface where one bone touches another bone. So at this point, the occipital condyles is where the first cervical vertebrae articulates or forms a joint. So this basically allows you to say yes to things, allows your head to move up and down. You can also see your external occipital protuberance again here on the posterior aspect. If I push it up a little bit, it's probably better seen from the posterior view though. You can also, from this perspective, see some features of the temporal bone here. Now this is simulating cartilage, but it is sitting in a little dipped part of the temporal bone. This is where the mandible, specifically the condylar process, sits. So this is called the mandibular fossa. And again, a fossa is just a depression. So the mandibular fossa is where the mandibular condyle will sit. And we've also seen this and this bone feature before on our lateral view. These, and you have them on the left and the right, are our mastoid processes. They're more lateral and kind of mountainous looking. And our styloid processes, which are sharp and pointy. And again, these are really important muscle attachment sites we'll come back to later. We can also see something that we saw before on the lateral view, the zygomatic process of the temporal bone, which reaches out to touch the zygomatic bone. And that's it for our bone markings, bones, and orientation on the inferior view. We're going to do another video looking at the openings.